Hi guys, it's Kiki, one of our exercise physiologists here at Changes alongside Tyler, one of our physiotherapists. Here at Changes we believe that both exercise and rehabilitation is the answer, so we're going to be going through both an assessment and a small exercise for a muscle called the VMO, or vastus medialis oblique. So this is a muscle that we look at if you've got any knee issues, if you've got any knee concerns, history of injury, or maybe had a replacement in the past. So it's actually a small little muscle on the inside of our knee here, or thigh. It originates from our outside of our thigh here and attaches onto our thigh or quadriceps muscles. So Tyler's going to take us through assessment and then I'll go through a small exercise.
Awesome. So as Kiki is setting up for me, before I do any sort of assessment with my patient, I'll get a brief history of how they've done it, what their pain levels are like, and anything else to do with strength and weakness pretty much. Okay, so Kiki's putting all these electrodes on her leg now. So this attaches to a thing called an EMG. Now here at Changes we're lucky enough to have one of these. So what this does is gives us an indication of the electrical output the VMO or any muscle in that fact is actually producing. So what I would do is test the good side first, record that reading, and then test the bad side. So normally what we do is get them to contract the muscle or tighten that muscle as hard as they can, hold it for around 5 seconds, then release. Now we repeat that process 5 times and record the average reading, and then compare the good side to the bad side, and then that gives us an indication of what we can do moving forward. So in this case I would find out that there was VMO weakness to Kiki's bad leg, and I'll refer her on to an exercise physiologist for any sort of exercise and strengthening for the VMO muscle.
So an exercise that I go through for activation of our VMO, I use something like a small foam roller, or you can use a rolled up towel or folded over pillow. And you want a flat surface, you can do this on the ground, popping underneath our knee like so, just underneath, so we've got a little bend. Place our fingers on the inside of our knee so that you can feel those VMO fibers when they contract. So similar to the EMG, you want to extend our leg and squeeze our thighs or our quadriceps as hard as we can, feeling that contraction of the inside of our knee. And then you relax. So that's one contraction. What I recommend is about 2 sets of 12 to 15 each side for activation, making sure you do both the good and the bad side to make sure that that good side doesn't get lifted out. So if you do have any questions or concerns, pop down and see either myself or Tyler, and we're happy to have a chat.